ziua tuturor și bine ați venit la acest webinar. Sunt Sorin Melenciuc, redactor șef al platformei de știri medicale 360medical.ro și vă voi prezenta subiectul acestui webinar, care este oncologia. Cancerul, după cum știți, este un subiect foarte important pe plan mondial, dar și în România, unde reprezintă o povară mare atât pentru pacienți cât și pentru sistemul medical. În fiecare an, potrivit datelor oficiale, peste 80.000 de români se îmbolnăvesc de cancer, sunt diagnosticați cu această boală și peste 50.000 de români mor în fiecare an din cauza cancerului în România. De această perspectivă, Austria reprezintă un exemplu pozitiv, unde atât screeningul cât și tratamentul adecvat scad această povară pentru pacienți și pentru sistemul medical. Îi avem invitați astăzi, în cadrul webinarului, pe reprezentanți ai unei rețele de clinici medicale din Austria, Premicamed, care vă vor oferi date despre beneficiile de care beneficiază pacienții în cadrul acestui sistem medical. O invit așadar pe Veronica Plăcintescu să discute cu unul dintre cei mai renumiți medici din Austria pe această temă. Veronica?
Hello everybody, thank you for coming here today. Bună ziua tuturor, mulțumesc foarte mult pentru că sunteți alături de noi. Today I will be talking to Professor Drach, who has been medical director of the Confraternität Private Hospital since 2012. And since Austria is one of the main medical destinations for Romanians for a few years now, I would like to ask you, Professor, how has the clinic developed during this time?
Yes, a couple of years ago, we have really focused on the medical profile of the hospital. We have established a lot of main medical areas where we work with specialists. And one of this area is oncology, but not only medical oncology, it is related to various surgical aspects, collaboration with specialists in the various fields of oncological surgery. And beyond that, we have focuses in the area of cardiology and other surgical disciplines like orthopedics and urology. Another focus in the past years was to improve the situation of the rooms, the situation of the building, to have renovations in this field in order to accomplish an optimal service for patients being treated in our hospital.
Now, given all these improvements and this development, as a specialist in oncology, you have seen many cancer patients coming from Romania. Could you say what diseases are probably most common?
Patients from Romania really correspond to what we can expect when we look at the frequent diseases that we see in oncology. So we frequently see patients with cancer of the colon. We see a lot of patients with breast cancer, but also patients with problems in the area of hematologic oncology, so mainly lymphomas and also multiple myeloma. Another area is that we also get patients with very specific questions, also some forms of rare cancer, but these are very specific questions to find a correct diagnosis and very individualized treatment approaches.
Austria has been one of the main choices because it is one of those countries where the chances of being cured are quite high. What factors would you say are decisive in this regard?
I think there are several reasons that put us in a very fortunate position as far as cancer treatment is concerned. Number one, it is the very interdisciplinary approach. So the close collaboration of disciplines, mainly medical treatment, surgery, radiotherapy, in order to find optimal treatment concepts for every individual patient. And the cooperation of the disciplines is is aimed already at the very beginning when we achieve a diagnosis, and then already at the beginning, a treatment plan with all disciplines is being formed. Second issue is that in Austria, we are in a fortunate position that we usually get very rapid access to medications and very rapid access to novel medications. This is a main development during the past years, that many new specific drugs for cancer treatment have been developed, and accessibility to these drugs is an important issue to improve patient care in the field of oncology. And the third reason I think that is very important in our country is that we really aim at a very short period, a very short waiting period for the patients. So in particular, when there is a newly diagnosed cancer patients, we really aim at very rapid access to the system, access to the treatment, so that we can utilize the advantage of getting patients really early to the treatment phase.
Indeed, in the past few decades, fundamental and crucially decisive improvements in treatment have been achieved. However, the incidence of cancer is generally increasing. Why would you say that is?
Well, one has to be careful with such data, because we need to recognize that also the average age of the population is increasing, and many cancer diagnoses just increase with age. So there may be some pseudo increase in the newly diagnosed cases, but nevertheless there is some real increase, and this is mainly related to pancreatic cancer that really increases in newly diagnosed cases. Also, lymphomas tend to increase over the past decades, and also lung cancer is still a growing number of patients that we see.
What would you say is decisive in the diagnosis of oncological diseases?
Well, in the diagnosis of oncological problems, it is very important to have very precise diagnostic tools in order to have a very specific staging of the disease, as we call it. So really to know what is the extent of the disease in the body. And so very precise staging is important, as well as a very specialized field of pathology. We know that a very careful pathologic diagnosis is a really crucial element for the patient, really to define on an individual basis the disease. And this is then important for any additional decisions, in particular decisions for treatment.
Now, you said about assessing specific cases. Why is personalized medicine so essential in cancer treatment? And what does targeted therapy mean?
So what we have learned during the past decade, I would say, is that there is not just one cancer diagnosis, even when we look at a particular organ. There are many subtypes of the disease, and there's almost a single disease in every individual patient. There are so many specific features that need to be considered for the diagnosis and treatment. So therefore, the specific diagnostic tools, in particular pathology and molecular biology, are so important, so that we can define what are the specific characteristics of the disease in every individual patient. And this is not just important for scientific reasons. This is now important for treatment decisions, because we have got so specific drugs. So that means these are drugs that are directed towards very specific features of a cancer cell present in an individual patient. In the past, we have used mainly chemotherapy, but this is unprecise. It is a medication that works against growing cells, against cells that have a changed pattern of growth and cell division. But this is very non-specific. Now we know that cancer cells have particular features, for example, some receptors on their surface, or within the cells, they have particular features that are important for the cell metabolism. And these features, they may be different between patient A, B, C, and D, even if it's the same cancer as far as an organ is concerned. And when we know these features in an individual patient, we can say medication A is good for you, but it's not right for you. And we can really precisely define what is the optimal treatment for an individual patient.
Now, following up on your answer, I would have a two-part question, let's say. You said that chemotherapy is an important part still in cancer therapy, but it is still feared by many patients due to the side effects. Mm-hmm. I would like to talk about less stressful drugs in this area on one hand, and the second part would be the immunotherapy, which is quite a new form of therapy, let's say. And as we know that cancerous patients have an attacked immune system. When is immunotherapy used? So let's start first by talking about a little bit about chemotherapy and switch to immunotherapy afterwards.
Yeah, these are very important questions. So as far as chemotherapy is concerned, it is still a backbone of treatment in many cancer diagnoses. As I have already explained, this chemotherapy just describes various medications that block cell growth, cell division at various stages of this very complex process. And we know that there are, of course, side effects and toxicities, but the important issue is that during the past 10, 15 years, we have access to new medications used concomitantly with chemotherapy in order to improve tolerability. So for example, now several medications are available to prevent nausea and vomiting. This is something many patients fear when they hear, oh, I need to get treated with chemotherapy. But we have very powerful medication to prevent that. And this is not a problem anymore. This is very good news for the patients. We have also learned that it's not necessary, or at least in many instances, it's not necessary to give the most intensive and most complex chemotherapy. We have learned that in many situations we can cut back and use better tolerable combination treatments, and also combinations together with novel agents that are non-chemotherapy drugs. And when we combine such strategies, treatment is even more effective and better tolerated. This is a major progress we have made during the past few years. And this also leads us to the second part of your question, to the field of immunotherapy. This is the most recent development in the field of cancer therapy, and of course a very important one. Well, also immunotherapy is a rather broad field, and one important group of medicines used in the context of immunotherapy are a group of medications that we call antibody treatment. Antibody treatment is based on the observation that there are very specific features of the cancer cell that may be targeted by an antibody. We know that antibodies are present, or antibodies are produced by the human body, for example, as an important step to fight infections or other problems. But for some reason, cancer cells have learned to escape from this immune reaction in the human body. And then we can use these antibodies as treatment. And when we give as an infusion these antibodies, they bind to the cancer cells, and then the immune system will be again able to recognize the cancer cell as something that needs to be attacked. So this is one important mechanism of immunotherapy, and this is now common practice in many diseases, that we combine such antibody treatment with established chemotherapy agents. And by combining two different mechanisms of actions, the treatment effect is much more potent compared to either approach alone. Of course, there are other ways of immunotherapy, and sometimes the approach is very difficult or very complicated, and it requires a lot of steps to define a particular medical approach for individual patients. So these are some very recent developments, but many of them are still experimental and they need to be better defined. And usually they can only be delivered in very special cases, very individual cases, and they are not yet available to a very broad range of patients. But again, antibody treatment as a very potent way of immunotherapy. This is common practice in many diseases of the broad oncology field.
Because you were speaking of, let's say, recent developments in medicine, I would like to switch a bit the conversation towards the modern surgery, which offers much gentler operating methods. Are any of these also relevant for cancer treatment?
Yes, this is also an issue in the context of cancer treatment. But this refers to a subject that we have already discussed earlier. This is linked to the fact that medical oncologists and surgeons need to work together in a way that we frequently define a treatment strategy that combines medical treatment and surgery. In other words, when the tumor is, let's say, large, or it is maybe the tumor is located in a very critical position of the body, it is recommended to use medical treatment, chemotherapy, antibody treatment first in order to shrink the tumor, and then after a couple of weeks or months of treatment, then it's time for the oncological surgeon to get in, and in this improved situation with a much smaller tumor compared to the initial diagnosis, it is then much easier for the surgeon to remove the residual tumor formation, and also to use a more gentle technique which is of advantage to the patient. So a very typical example is the treatment of breast cancer, because the breast conserving surgery is standard in our country, and use of preoperative chemotherapy and then breast conserving surgery, that is a concept that is now applicable to almost 80% of patients with this disease. And this is of great advantage, of course, as you can imagine. And this is a very typical example how improvements have been made in this field.
Now, the Confraternität private hospital, where you are a medical director, is a relatively small hospital with just a little shy of 100 beds. Nevertheless, we know that top-level medicine is offered here. How does everything work? How does it work?
Yeah, well, a number of inpatients with 96 beds sounds, as I've mentioned, like a small hospital. This is true, but you have to consider that in modern medicine, the time in the hospital is getting shorter and shorter. What was a stay over a week 10 years ago is now maybe 3 to 4 days. So this is a development in modern medicine, and therefore, even with close to 100 beds, we can deliver our service to many patients. It is really an effort to organize it in an optimal way and to deliver excellent service within a short period of time to a good number of patients. This is the consequence of this. But this is one issue, the good timing and organization. And the number two is besides the availability of treating patients as inpatients, we also have several positions in our outpatient clinic, so where we can deliver services to patients in a way that they come in the morning, get their treatment, and leave in the afternoon. And number three, there is also an outpatient area for consultations, for very limited interventions, for some checkups or follow-ups a few days after surgery or any other interventions. So together with all these units, we are in the position to deliver our services to a good number of patients, and it's not limited by just the 96 inpatients.
Professor Drach, you have very extensive experience in medicine and oncology, and your specialty includes the treatment of malignant lymphomas. What developments have there been in this area in recent years?
Yeah, it has been a fascinating time in the area of lymphomas because really major improvements have been made in several areas. The number one is we have learned a lot about very specific subtypes of lymphomas. So together with pathology, we have learned to better classify the lymphomas, defining different sub-diseases. So not only Hodgkin's and non-Hodgkin's lymphoma, but many other subtypes that are clearly defined and that help us to find better individual treatments for lymphoma patients. So really an improvement in the diagnosis has been made. The second issue is that in particular with the availability of PET-CT, we have got a very powerful instrument for staging. So to define the stage in an individual patient. And this has also reduced the necessity of some invasive diagnosis, so like bone marrow biopsy. It is rarely necessary today with the access to PET-CT. So we have really powerful new staging methods to better define the individual stage of a patient. And then in the third area, that is clearly the advances in the treatment approaches. So, and combined immunotherapy, chemotherapy approach, this is now standard in many lymphoma patients because in particular in the field of the so-called B-cell lymphomas, various antibodies are now available, and in combination with chemotherapy, the efficacy of treatment has been improved a lot, and the treatment outcome has gotten much better for the patients. On top of that, we have got a lot of new targeted treatments, not only antibodies but also other medications, and this is particularly evident in the lymphocytic lymphomas, also known as chronic lymphocytic leukemia, where chemotherapy is rarely used today. So we really talk about chemotherapy-free treatment approaches in this disease due to the development of new, very effective drugs in the treatment of this disease. So all these factors together have dramatically changed the field of lymphoma, based on better diagnosis, better staging, new medications. And yeah, I hope that we continue to see this progress also in the coming years.
Now, sports and physical exercise is usually recommended for maintaining a healthy lifestyle. Do you have any advice for patients regarding the physical exercise during or after cancer therapy?
Yeah, this refers to a very important field. What patients can do beyond this medical treatment, and this is a question we frequently get: what else can I do? And what about lifestyle and physical activity? In particular, in the context of oncology, physical activity can do a lot, because when you do it, or when we activate this in patients undergoing cancer treatment, we can accomplish a better tolerability of treatment. We know that, for example, in the field of chemotherapy, that there is a frequent side effect that we call the fatigue syndrome. This is a syndrome characterized by tiredness, by really a lack of energy, by the feeling, well, it's very difficult for me to stand up and get something done. And there is no medication or something like that to handle that. But when you get when you get to the point that you are able to do some physical activity on a regular basis, then this is the way to get out of this fatigued syndrome. So we do not talk about major efforts that you need to accomplish. There is the recommendation to do 150 minutes of activity per week. So 2.5 hours per week. That is something that is really possible to get done in a week. And we do not talk about very strenuous exercises or efforts. You should try to do some moderate activity on a regular basis in this recommended time period. And this will do a lot, and it will change your life and your well-being, and it will diminish the side effects that we see during chemotherapy. But physical activity is also recommended being done after cancer treatment. We know that physically fit patients and those doing regular physical exercise, they have a much better prognosis, in a way that the recurrence rate is being decreased. There's excellent scientific data on this topic, showing, for example, in colon cancer, but also in breast cancer, that the recurrence rate is significantly reduced when you do regular exercises. And this is a medication that is easily available. You do not need a prescription. You do not need to go to the pharmacy. It is in your hand. You can do 150 minutes per week. It will change your life, and it will do a lot. And this is also an important message I would like to make. This would be something that has an established place in the prevention of diseases, and also in the prevention of cancer diagnosis. We know that something in the development of cancer is related to our genetic background. So it's in the genes, but this is not all of the story. It may be 50%. And the other 50%, this is something that every individual person can change by yourself. Genetics we cannot change, but the other issue, the lifestyle, the activity, that can be changed, and it's in our hands what we do. And with regular physical activity, this is an important contribution for healthy lifestyle and for the prevention of many severe problems in the field of oncology, and of course also cardiovascular diseases that is well established by many, many studies.
As we were talking in the beginning, Romanians choose Austria as a medical destination for already a few years now. Is there any case in particular from Romania that you remember well?
Well, there are many cases that I remember very well, but I can share with you a case of Hodgkin's lymphoma. Usually Hodgkin's lymphoma, this is a disease that affects young patients. And when a young patient comes and asks for a second or even third opinion, what can you offer to me? Because I have a recurrent disease, and nobody can offer me some effective treatment. And when you then are in the fortunate position to get access to a new medication and offer this to the patient, also a specific form of immunotherapy, and then this leads to an improvement within a few weeks, that the symptoms decrease, the fever decreases, the general condition improves, and then the patient improves from every treatment cycle to treatment cycle, and now is in ongoing remission for more than 3 years. This is something that really gets to your memory and comes to my mind when I get questions like this one. This is very, very impressive, and also many co-workers in the hospital are then they are very, let's say, pleased to see such very special cases, what modern medicine can help, and this is then motivation to all of us.
You did mention offering a second opinion, so you are also offering a second opinion at the hospital.
Yes, this is an important part that we offer. We have several, let's say, packages that we can offer for second opinion, including also a second opinion in the diagnosis based on re-evaluation of biopsy or surgery specimens, re-evaluation of diagnostic images, CT, MRI, and so on. And then, of course, also the second opinion regarding the treatment approach, and this can be this can be structured in an individual basis according to the needs of the patient. And these second opinions can be delivered either in a personal consultation when the patient decides to travel to Vienna. This may be a little bit difficult in the current times, so therefore it's also possible to deliver such second opinions via other forms of communication and also remote consultations.
Yes, I was actually wanting to go there. So are you also offering video consultations? Because traveling has been quite challenging this year, and we were wondering about video consultations. Are there also a possibility?
Yes, this is also a possibility, and it is being used more and more frequently. Of course, because of the current situation where traveling is difficult, but also in general, I think this is the way. This is a future way how we can deliver consultations, because for patients who have symptoms, who may be weak after an operation, or they may be weak due to the disease they have, it may be difficult to travel, and therefore a consultation via video conference or these electronic meetings may be a very good alternative, and it may be very patient-friendly under these circumstances.
Now, staying a bit in this area, safety is a particularly important issue nowadays, and I'm very sure it's even more important for patients with cancer. What security precautions are taken in this regard in the Confraternidad Hospital?
Yeah, safety is an extremely important issue nowadays, and we have made tremendous efforts to provide this. Therefore, we do consequent testing, viral testing in every patient being admitted to the hospital. So prior to admission, so it is required to have a valid COVID-19 negative result prior to admission, and this may not be older than 48 hours. So that is a routine testing that we have been doing since the beginning of April, and it has had a major positive effect in a way that we can really deliver all our services without any problems, without any positive cases in the hospital, and also positive cases in the personnel of the hospital. We have expanded the testing strategies also, of course, to the personnel of the hospital. Now, at least once per week, antigen testing is being performed by the personnel of the hospital, so we can really deliver safety to everybody who wants to come or who needs treatment, and we can offer treatment in all our fields of expertise because of these preventive steps that have been taken. We also need to consider that we limit access to the hospital beyond the group of persons who are patients, and of course, close relatives that are really needed for admission. But then with visiting people, we need to be very restrictive at these times, because it is our goal to be on the safe side and to be able to provide all our services to as many patients as possible.
Now, before closing, because I know you have a very busy schedule, apart from the security and safety we were just discussing, in your opinion, what other great advantage, the greatest maybe advantage for oncological patients to be treated in the Confraternidad Hospital? Is there anything you can mention?
I think really an advantage we can offer is that we have a very concise cooperation of the disciplines. As I have mentioned, in Austria, this is a general approach to cancer treatment, but we have a hospital, as you have mentioned, with 96 beds and some outpatient areas. But this is also the strength of our system. So it is within one building, we really are able to deliver the different specialities, and this can be done at very short notice. So when we are faced with a patient and then, for example, with a newly diagnosed cancer problem, we can very fast assemble a group of specialists covering all the important aspects and come up with a treatment approach for the individual patient, and that can be then delivered also within a very short time. We know time is essential in the diagnosis and treatment of cancer, and this is really the focus that we want to deliver and that we can deliver for these patients, and this is also the feedback that we get, that there is an expert care within a short period, and this is the strength of our center.
Thank you so much, Professor, for taking your time and being with us today. L-am avut alături pe domnul dr. Johannes Drach, director medical în cadrul spitalului privat Confraternität din rețeaua Premicamed din Austria. Thank you very much. Mulțumim frumos.
Thank you.